My name is Dr. Liza Di Enno, and I'm a board-certified physician practicing inpatient and outpatient clinical medicine since 2016. I've seen older patients, older citizens struggle with maintaining independence and functionality even as they enter their twilight years. They want to stay independent, and sometimes it's more or less easy depending on what challenges they face. Some common issues I've seen elderly people struggle with are things like failing eyesight, balance issues. Sometimes the medications they take to help with problems can have side effects that can make daily living a little bit more challenging. Things I see in seniors after they've had a fall, even if it's a minor fall, can be bleeding and coagulation issues. For instance, if they're on a blood thinner, skin tears, broken bones. Elderly people have more brittle, more porous bones that are more prone to fractures, even from a simple trip and fall in the home. There are a lot of things seniors can do to help them age in place and maintain their independence well into their twilight years, okay? I think being aware of the struggles that may be coming is definitely the first thing. When we have medications, making sure we keep an up-to-date list of those medications, not only on themselves, like in a wallet or purse, but also posted next to the phone in the event of emergency. Better to ask and it be nothing than have it be something. And I like to tell seniors, let's look at our home environment and see what could be a potential hazard, okay? So area rugs can be very tricky, especially for people with limited mobility. They can slip, you can catch your toe on the edge and fall. Seniors should consider, if they're looking into mobility aids or considering employing something along those lines in their home, would be primarily, what do you feel are your limitations? What are your challenges in particular? And that's really going to guide your selection of that mobility aid. After that, I would consider, what is your furniture situation? How high is it? Can you adjust the furniture itself? Things I like about the step-to-bed include the dual handbar grips, okay? We don't have to worry about one side or the other. We've got two options there. Either way we reach out, we're gonna grab something. Okay, I really like that extra wide base. There's not a lot of looking over our shoulders or guessing. We've got a nice wide area to land on. I like that there's a non-grip strip on that base. It can be very helpful. I like that it has a motion-activated light that illuminates not only that step, but also the floor around the step-to-bed. Advice I have for adult children who are caring for elderly parents is to keep lines of communication open. Communication is so important, okay? Be aware of your parents' wishes or your elderly relatives' wishes, not only for after they've passed, but clearly as they're aging in place. I encourage adult children to be actively involved in the medical care of their elderly parent or relatives. Patients that might benefit from the step-to-bed are not confined to the elderly population. This could be very, very helpful for anyone who's struggling with some mobility, even if it's just temporary. People who have had knee replacements, hip replacements, people who are having back issues or have recently had back surgery. There are lots of things seniors can do to maintain their independence and their mobility even as they age. One of the things I always tell patients is motion is lotion, so stay active. If that's gardening, light housework, that works for you, that's great, okay? If it's mall walks or nature walks, good on ya, okay? And as for mental fitness, we talk about Sudoku, crossword puzzles, other puzzle games that involve really making those connections and keeping those synapses firing are really great for keeping those mental muscles limber as well. Please ask your doctor questions. If something is not clear, please ask them to say it again or say it a different way. If hearing directions is not helpful for you, please ask for it to be written down, okay? And if something doesn't sound right to you, please bring that up to your doctor. There are a number of things seniors can purchase or install around their home to maintain their independence as they slow down. I think everybody thinks of a walker or a cane. Those are two things, those are two options. Moving towards more lever door handles as opposed to the grasp and turn doorknob, that can be more helpful. And consider a ramp. That might be easier, even if you're not in a wheelchair, just to not have to negotiate those steps, more of the smooth, steady incline of walking up a ramp. After seniors have fallen, I've seen a number of health-related issues. Senior citizens do not recover as quickly from injuries or medical intervention as younger people. There are longer hospitalizations following even just small, slip and falls in the elderly population. And so there's an increased chance that that elderly person may have an accident after they've already had that fall. I would recommend the step2bed to seniors. It has a lot of features that can increase that independence and mobility. This is a product that can safely help a senior citizen maintain their independence past a time when previously they might not have been able to do this on their own.